We have Beth Johnson, the CEO and president of Coordinated Care.
Nice job.
So you've been in this position now for long enough to have your feet on the ground and know kind of...
know where the ground is.
Yeah, up from down and all that good stuff. The Medicaid space is different from much of where you've spent your planned career in Regents and Primera. What have you sort of learned about the complexities and nuances of Medicaid in Washington State since you've taken over this role?
I learned a lot and have a great team in supporting that learning and great partners in supporting that learning. You know, funny enough, when I was at Multicare, Healthy Options 1992 was starting, and I was actually there, and Multicare had an Healthy Options plan, which I was a part of. So it's kind of a reintroduction, and when I was at Regents, we had a Medicaid plan. So I've always had some tangential accountability for Medicaid. As you know, we are one of the 5 Medicaid MCOs. We are sole source foster care. And some of what I am finding extremely gratifying about Coordinated Care is the mission that the folks have, that they've invited me into and be part of that team. You know, we are working across the board on mental health first aid with the behavioral health integration. The whole teams, everyone from me down to the line level employees, are being trained in mental health first aid. We have a very driven by our foster care population, a trauma-informed approach to care, where people are familiar with ACEs and resiliency, and kind of looking at how a lot of managed care organizations and a lot of health plans look at their medical management portfolio of those folks who are complex and need high levels of case management, and those folks who are less complex, and then those that we are well and we want to keep well. Looking at it from a foster care, a pediatric Medicaid space, and then even into our exchange population, where most all of our 80% of our lives are subsidized, we kind of take a look at how can we learn from the trauma-informed approach that we've brought to foster care to the rest of our pediatric population, our Medicaid population. And one of the things that we're hopeful, along with the Healthcare Authority, that the Healthcare Authority will be granted one of the 8 Medicare demonstration projects here in Spokane that we will help them administer, called Integrated Care for Kids, which is a new way to look at what are some of the additional approaches we can wrap around kids' care and look at different success measures, kindergarten readiness, you know, accessibility to food, behavioral health. So it's been really a really cool journey to see how we can incorporate those types of things into healthcare that hadn't been a part of kind of employer-based healthcare in my past couple of years.
Yeah. So you're seeing that sort of ACEs and trauma-informed care that you guys do for this subset. I mean, you're the only statewide MCO that deals with foster kids.
Correct.
You're seeing that sort of infuse your other lines of business or other cohorts?
We've had great, and I credit the team. I know Tori is here, and Ruth, and you know, others who are on different panels, Dr. Waring, Dr. Sims, who kind of started that. And you know, people in Medicaid have trauma. People in foster care have more trauma. What can we learn that we do so well in the foster care population and move to other populations? Again, maybe not with that same level of intensity, but there are going to be those services that are needed in various vulnerable populations. Kind of too, this is my first foray into a large national organization, and had some curiosity about how that would work. I've been mostly with, you know, with First Choice and, you know, Local Blues, which are wonderful organizations, learned a lot, and they serve a great niche. One of the things that I have really appreciated about Coordinated Care being part of a larger Centene organization is I have 25 plus peers who are accountable for their markets, for their Medicaid population, their exchange population, and others. I haven't encountered a challenge which one of my counterparts in another market hasn't experienced and learned from that. And that we repeat that learning. Our Illinois plan just won sole source foster care. We have a team from Washington helping the Illinois plan. What do you need to plan for? What worked well? What didn't work well? You know, how do we do that? So it's been a real interesting mix. We have hundreds of employees here in Washington, so we are very local for what matters to be local. We have a couple of office sites, so we are infused in the community. We also have that ability to draw upon some national expertise when we need it.
I don't think it's not an overstatement to say that of all of the folks who work in Washington State healthcare, you are at the top of the list. Like literally, probably nobody has more experience thinking about value-based payer provider contracts
Right.
across the range
Are
of
you
what
saying
that.
I'm old, DJ?
No, I'm not. No, I'm not. I'm saying you started work at 12 and you've been very successful ever since. So how would you characterize the state of value-based payment? Medicaid has big aspirations for that.
Right.
And
Right.
there was some of that catalyzed from the ACA. And folks have tried a lot of different things, but it does feel like there's a little more marketing than meat, so to speak, and that for our aspirations, we're slow to hit those marks.
We're getting there. I mean, I think we would all agree, we're all in healthcare in this community. We're still in a pretty novice state with value-based. And I think one of the great opportunities we're going to have to demonstrate leadership in that as a community is around the integrated behavioral health. Certainly the vision of the Healthcare Authority, which has come to fruition, there's been a forcing function of pulling the premiums together. That's where we've kind of stopped for the first year. Now we need to really say, how can we do things different, with behavioral health and physical health integration? It's a great first step. And again, I think we would all recognize, at least those of us in the Medicaid world, it's been a great first step and we have a lot more to do. And I'm confident that as providers get comfortable with the way things are changing, we've had some encouraging conversations with some behavioral health providers who are willing to look at what does that next iteration look like. So I'm actually hopeful that the behavioral health integration will help us leap forward in these value-based agreements.
Yeah. We sometimes in healthcare have a little bit of a Lake Wobegon effect where we're all above average.
Right.
I think that's certainly the case with accountable communities of health. However, there is still average, above average, and below average.
Sure.
I would characterize the Spokane region as above average in terms of ACHs. Given your statewide view, what is unique about the Spokane region in Medicaid, the ACH in particular, that folks here in the Eastern Washington region might take for granted because they're living and working in that space all the time?
Well, I think, Dr. O'Brien mentioned just a confluence of healthcare organizations here that I think lead to just a more sophisticated, organization. Allison as well has done a phenomenal job of leading the Spokane ACH. And I think it has been a collaborative environment that we see here in Spokane that maybe we haven't seen in other parts of the state. So I would say there's those things, and then there's just a need for us to kind of pull together. No one organization has all of those components, and I think what we can learn from the Spokane community is let's continue to do that. And if we're going to advance the health of Washington communities, which is we're all here at the State of Reform in Washington, we're all committed to our communities. We as MCOs have ideas, behavioral health providers have ideas, physical health providers have ideas. We don't all have the full solution, but I think Spokane is one where it demonstrates there is a maturity to the market and they have a collaborative spirit that I think we can learn in other areas. And that is one of the reasons why when we were looking at this CMS demonstration program, we chose Spokane as the demonstration site for that, because all of the ingredients for making it a successful pilot that we can then launch through the broader part of the state, I think lends itself here in Spokane.
What did you make of the public option effort in this legislative session?
I would say it is trying to accomplish what we all want, which is more access and affordability for folks. I was just, while I was very much paying attention to everything you were saying, I did glance at a couple headlines.
You didn't like my Memphis Belle story?
I did. I remember that movie, actually. There was a headline in the Washington Post, and I'm going to get it wrong because I just glanced at it, but health insurance and accessibility to health insurance, the numbers are down. And so we don't want that. Nobody wants that. The hospitals don't want that. The providers don't want that. It's not good for the community. So the public option, I think, is an approach to take a look at that. I think there's multiple approaches. I think with anything, we'll all work together and figure out how to make it work and make it work well. We're supportive of anything that's going to help with access and affordability for Washingtonians.
Yeah. And what do you make of, again, this is sort of to the extent that you can, which I know you can't, but take your hat off, the Centene hat, and we're just sitting around the dinner party table. What do you make of this sort of political kind of upheaval on the left around Medicare for All, and how that is really becoming and has been a thing in the Democratic nomination process, and it's going to be a thing, just like repeal and replace was a thing for a long time. This is going to be a thing for a long time. What are your thoughts on that?
You know, we all need to pay attention to national politics, but I think whatever happens on the national level, regardless of it's Medicare for All or anything, it's years in the making. We saw that even with the ACA. I think here in Washington, the leadership here throughout the public and the private organizations have done a fantastic job in access and affordability with expansion of the Medicaid program, with fulfilling the ACA. We think in the short term, we just need to continue to work on what were those opportunities that we haven't yet fully availed ourselves of in the ACA. More expansion. I know part of the public option was to look at a study around can we look at expanding the FPL for subsidies? How do we get more Washingtonians supported in a healthcare environment? I think it's something that we can all rally around, and the state has a good history of doing. And I think the mechanisms we already have in place, the Medicaid expansion, the exchange, is a way that we can continue to work. And you know, you kind of asked about you know, my experience at Coordinated Care. I think we are one of those organizations that tried to fully take advantage of, for the benefit of the community, the Affordable Care Act, in that we're in Medicaid expansion as the state expanded Medicaid. A lot of our members, 80%, are subsidized, so we have that continuum of Medicaid, expanded Medicaid for those who are at a, you know, a certain income level, subsidized exchange for those who are still challenged with the funding of it, and regular exchange. So we have that opportunity to continue to support those programs, and I think continue to get more Washingtonians insured through that.
So last question, again, what advice would you give folks based on your experience and what you're seeing and what you're learning about how best to navigate this tricky time?
You know, I don't think it's anything differently than what we've already kind of discussed, which is we all have pieces of the solution or ideas, but we can't all put a solution in place on our own. And to the extent that we can come together and put value-based agreements in place, work physical health and behavioral health, work the continuum of programs and projects, I think Washington will continue to get a long way in leading the country in getting folks in coverage.
Yeah, Beth Johnson, President and CEO of Coordinated Care. Thank you very much for being here.
Thank you.
That's great.
Thanks.
Thank you.